My name is Taya Graham, and welcome to the Inequality Watch. Just a quick explanation about why we produce this show. Sure, it's about inequality, the most extreme threat to the political and social well-being of humanity since the birth of civilization. But what does that word truly mean, and why does it matter? Perhaps it's easier to think of the imbalance of wealth as a disease, a pathology that manifests itself in ways that we don't always link to the underlying condition, which is what we're going to do today. Because like a virus, excessive wealth corrupts the entire system. It's the rot from within that anti-capitalists predicted, but also a corrosive force that has evolved to take new forms, which we don't always recognize. So today we're going to give you an example of the civic contagion, how the disease of wealth inequality has adapted to spread its tentacles into almost all aspects of public life. Why, like the said virus, it becomes self-replicating and insidious, and ultimately how it affects you. To explain this idea, we're going to start with a developing story about just one public official. It's a story of corruption so deep, a recounting of her crimes doesn't do it justice. In fact, to truly understand how destructive her acts of malfeasance are, we need to understand them within the context of the show's theme, inequality. To begin this tale, I want you to consider something you may think is unrelated: medical bills. Have you ever received a medical bill that seemed unreasonably expensive, a set of charges that are not only impossible to explain, but prohibitive in cost? Have you ever had to undergo a medical procedure and thought you received the last invoice, only to receive a surprise charge months, even years later? Well, you may wonder why, in an alleged democracy, this is possible. Why, in a country purported to be run for and by the people, would something as essential as healthcare be a fiscal death trap? Why the richest country in the world can't afford to keep its people healthy? Well, to explain how this American healthcare system works, I want to start in a place you might find unlikely: the final public press conference of Baltimore Mayor Catherine Pugh. Here, Pugh is trying to explain why a Maryland hospital system paid her over $500,000 for books she wrote, but in some cases never printed. The books in question were a series of children's stories called Healthy Holly. They were poorly written and widely ignored, but apparently to the University of Maryland medical system, they were invaluable. Let's listen to Pugh explain.
Let me stress, Healthy Holly initiative was never about books. It was about a lifestyle. We developed jump ropes, and then my thought process was, what else can we do to send the message that our children need to live healthy, and we need to make sure that we're providing every opportunity for them to be healthy.
Stephen, you were there for the press conference. What led up to this?
Well, what led up to was a revelation that the University of Maryland Medical System Board had given Pugh a contract to purchase these books for about $500,000, about 100,000 books, and the books were nowhere to be found. So supposedly they, were supposed to take delivery of these books to give out to kids in the city, but the books were not at the University of Maryland Medical System. No one had really seen that many copies of them, and the school system couldn't account for them. So she was trying to answer questions as to why all this money had been paid to an LLC that she had set up, and why the books didn't exist, and why even the University of Maryland Medical System felt it necessary to pay her this amount of money for books that, really weren't considered bestsellers, let's put it that way. So there were tons of questions swirling around her, swirling around the medical system. She's on the board of this medical system. She's on the board. When this deal was done, she was the senator in charge of a committee at the state level that actually had jurisdiction over this hospital, because the hospital, while it is a nonprofit, also gets tons of state funding for, capital improvements. So there were all these questions because it seemed to everyone like a real serious, if not a conflict of interest, an outright bribe of some sorts.
So the scandal was billed as an example of graft and bribery, another instance of public officials using the power of their office to enrich themselves. But it's not that simple, because the source of the money for all these phantom books is telling. It's your healthcare system. The biggest purchaser, the University of Maryland Medical System, a quasi-private hospital that has received generous amounts of public funding. And it is also an institution that recently asked to raise prices on patients by 5%. The move was called insensitive to patients and ill-timed. But as it's called, had little problem justifying paying the mayor hundreds of thousands of dollars for worthless books that never existed. The board approved the expenditure without debate. Let me repeat. a private facility that has received generous public support to deliver health care to the people, that recently raised prices, spent hundreds of thousands of dollars on books that in some cases never even existed. And UMS wasn't the only healthcare provider with spare cash. Turns out an investigation by the Baltimore Sun revealed that health insurer Kaiser Permanente also bought $100,000 worth of books. They too apparently had lots of spare change to buy off Mayor Pugh, who incidentally had control over their contract to supply health care for city employees. But it doesn't end there. It turns out that our former mayor was not the only public official to be feeding off the healthcare system's trough. Former State Senator Francis X. Coley was running an insurance business out of his basement that contracted with UMS for millions of dollars per year. And that largesse didn't end with him. His sons also did business with the hospital system, netting millions of dollars worth of contracts. The bottom line is local public officials who sat on the board of the hospital didn't spend their time trying to deliver more affordable health care or worrying about how strapped patients could afford rising prices. Instead, they concocted a self-serving get-rich scheme. Conflicts of interest so deep, they led to an 11-count indictment against Pugh and an ongoing federal investigation. Stephen, what strikes me the most about this case is the craziness. Aren't people like Pugh and Kelly supposed to manage the system to benefit the patients?
Yeah, all board members have a fiduciary responsibility to manage the resources of the institution to the benefit of the people it's supposed to serve. So the fact that they were cutting themselves deals, and we should note that Francis Kelly's deal was much more lucrative than Pew's. He was making millions and millions, and he has not been subject to any sort of investigation so far as we know at this point, and his son. So it was basically like a big, sort of, money treasure box for these people. And they were able to just dole out this money in any way, shape, or form they wanted with no oversight. The board is supposed to be the point of skepticism, right? Where they say, why do we need to spend this money? Instead, it was like, hey, let's just dole out money to our friends and family and to this politician who we need in our back pocket. And let's, spread the wealth that way. And also, it's interesting that you mentioned Kaiser Permanente because there is a healthcare company that has a contract with the city, so they're making tons of money off the city, and they had all this extra spare cash. This is a lot of money to be doling out. And in the case of Francis Kelly, millions of dollars to his family. So it really raises questions about our whole healthcare system in terms of where is all this money going? Why do they have so much excess cash? Why are they so flush? And yet we're so broke from trying to pay them.
But the feeding frenzy for public officials doesn't end with the scandal. In fact, there's another aspect of this story about local politicians profiteering that in some ways are even more disturbing. And it's a tale of how the military-industrial complex and our greed infused our healthcare system and combined to create profits for capitalists, waste for state residents, and a system that simply doesn't work. I'm talking about the state's decision to buy these AW-139 helicopters. The military aircraft equipped for tactical surveillance and troop deployment were purchased for hundreds of millions of dollars by the state, wait for it, for medevac missions. That's right, the state that often touted its taxpayer-funded medevac unit as a model for the nation spent roughly $200 million buying military-style helicopters to supposedly perform life-saving medical evacuations. Stephen, can you explain this a little bit and tell us who benefited?
Well, first of all, it's not explainable because a medevac helicopter should be a very, sort of low-key kind of thing. But we bought these, sort of souped-up surveillance helicopters that are used for military-style missions. And this is where the rubber hits the road. Let's put Healthy Holly in perspective. They spent $500,000 trying to pay off a politician. Well, in this case, they spent hundreds of millions of dollars for military equipment, which is being borne by the patients, by people in the state, to no good end. Because these helicopters vibrate, they're used for rappelling, they're used to ferry around like 16 or 17 soldiers. And somehow they end up being used in our medical system to take a patient who got in a car accident. And there's been predictable results, as you're gonna talk about. They don't work. That most of them are out of commission or have run up millions of dollars of excess repair bills. But it is a perfect example of how this medical system isn't really a medical system at all, but a way to generate profits for even the military-industrial complex. I mean, it's hard to believe. It's hard to think about. Like, you would think, okay, maybe just overpaying doctors or insurance companies would be benefiting at this trough. Well, guess what? The military-industrial complex, military contractors, a foreign military contractor, AW-139 is Augusta Westland, which is based in Italy, benefit. Now, my conspiracy theory is that then Governor Martin O'Malley, who was governor when this occurred, who was the former presidential, who we call the 0% presidential candidate, who presided over zero tolerance in the city, 700,000 illegal arrests. Yeah. He wanted the contract because they were assembled in Philadelphia, and he wanted to do a favor to politicians in Pennsylvania because he thought Pennsylvania was key to his presidential run. And that's my conspiracy theory. But it just shows how they say well, there's not enough money in the medical system. We can't do Medicare for all. We can't give people medical help. There's just not enough money. But there's enough money to buy helicopters, books, put cash out. There's plenty of money for that. That's the point of this. It's not just a graft of one politician, but there's plenty of money. It's just being used to help politicians get richer and to secure their own power.
Let me ask you something. Isn't there some difficulty in the actual flying of these helicopters?
Yeah.
It takes 2 pilots, right?
That's a really good point. So when I did an investigation 7 years ago, it used to be the medevac helicopters were operated by one pilot, which significantly reduces expenses. But the AW139 is such a complex aircraft, it takes 2 pilots. The Maryland State Police tried to do it with 1 pilot, and the FAA said, oh, no, you can't fly this with 1 pilot, you need 2. Doubling the cost. Right. And these things are huge. You can't land them like in a wooded area, or you can't land them on like most highways because they're so big and they're so heavy, they tilt over and stuff. So they're absolutely impractical.
Wow, so they really shouldn't be used in an urban environment.
Yeah, no, they're really not really appropriate for medevac because they're just too cumbersome. They're really meant for medical, they're really meant for military missions, and they're also meant for if you're ferrying oil workers out to a platform or something.
Okay.
They are not meant to pick up one patient on a 2-lane road somewhere and ferry them to a hospital. It's not what they're for.
And so what happened when politicians and military arms manufacturers collaborated to improve our medical system? Well, predictable results. The costs went up while the number of patients served went down. We spoke to a citizen watchdog who's been following this troubling development, and he had an interesting explanation. Let's take a listen.
Well, the trends with the new AW139s, the Maryland State Police helicopters, the trend is cost is going up and patient flights are going down.
So why would the state buy these arguably military helicopters? Why would the state need to buy something that really was a military piece of equipment?
Well, it is what they call a tactical and military aircraft. They're set up with a tactical suite inside the aircraft, as well repellent bars on the outside of the aircraft. Absolutely, I would not want to be medevaced in a multiple mission AW139 helicopter.
Why not?
Because it's not special for air ambulance. It's a multi-mission helicopter, so you got vibrations to deal with. So you're 5,000 to 1,100 patients, but yet cost is going up 72%.
What does this say about our healthcare system?
I didn't know we had one.
So as you know, we like to give awards on the Inequality Watch, and I would feel remiss in this episode if I didn't give one out. I mean, we have a politician selling fake books to healthcare organizations for hundreds of thousands of dollars. We have executives at those same companies apparently so flush with cash, they didn't even blink when asked to write huge checks to an elected official for a big handful of nothing. And then those same individuals decide to saddle the state with high-tech military equipment parading as air ambulances. And don't forget the decision to raise prices for patients amid a burgeoning scandal. All this against the backdrop of a medical system that is the most expensive in the world, which continues to fail patients and deliver mediocre results. That's why this week's award is so special. It's meant to encapsulate this problem of government by greed, and we hope it embodies why obsessive self-interest creates truly bad results. We call it our Greed Makes You Stupid Award. In other words, the basic underpinning of capitalism, greed, makes you dumb. Think about it. Only greed would motivate a mayor to fake invoices for books she never printed. Only avarice would prompt a hospital board tasked with protecting the public interest to write blank checks to a crooked politician while they raise prices for the rest of us. And only the confounding stupidity which accompanies this disease would create a medical system that bankrupts people rather than heal them. I'd like to thank reporter and editor Janis for his in-depth investigative work on this piece. And I would like to thank you for joining me. And if you have anyone who you think should get the Greed Makes You Stupid Award, please tell me in the comments. I would love to know who you would think should get the next award. My name is Taya. Thank you so much for joining me for this Inequality Watch.